All right, so we're going to go over the adult pressure injury risk, which is also known as a Braden assessment scale. Now, this is actually an international tool that is used within nursing to determine a person's risk for pressure injuries. And although the pages might look a little bit different on various forms at different healthcare facilities, generally this table is kept in the same format. So most facilities have a policy that all patients must have the Braden pressure injury score done within 8 hours of admission. They must have it done post-operatively on deterioration of a condition at transfer, so between different wards, and if they are at risk at discharge. Other than that, some facilities may also have policies where the score needs to be done, or the scale needs to be done every week on a weekly basis, or sometimes on a per day basis. So over here on the left, you can see the various risk factors: sensory perception, moisture, activity, mobility, and nutrition, as well as friction and shear. And all of those are used to calculate numbers where we determine a score at the end. So for example, with sensory perception, here the patient has been categorized as a 4, whereby they have no impairment, they respond to verbal commands, they have no sensory deficits which would limit ability to feel or voice pain or discomfort. If they were slightly limited, so respond to verbal commands but cannot always communicate discomfort or need to be turned, this may be your patients that can follow instructions, but maybe they have a speech impairment or stroke, or alternatively, they may have some sensory impairment, such as a diabetic patient with neuropathy. For moisture, this is the degree to which skin is exposed to moisture. In this case, the patient has been deemed a 4, where they are rarely moist, the skin is usually dry, and linens require changing only at routine intervals, which are usually once a day or once every couple days. For occasionally moist, the skin is occasionally moist, and requires an extra linen change approximately once a day. So this is if the bed feels damp and you need to change the sheets. Very moist, the skin is often but not always moist. Linen must be changed at least once a shift, so that's once every 8 hours. And constantly moist. Dampness is detected every time the patient is moved or turned. So you give your scores based on if they were constantly moist, it would be a 1, but in this case it's a 4, which means rarely moist. Activity and degree of physical activity. If a patient is bedfast, so confined to bed, they would be a 1. Chair fast, so their ability to walk is severely limited or non-existent. This would also include patients who can only pivot transfer, and patients who cannot bear their own weight or must be assisted into a chair or a wheelchair. Walks occasionally, so very short distances with or without assistance, spends majority of each shift in the bed or chair, or walks frequently, at least twice a day, and gets up once every 2 hours during waking hours. So in this case, the patient has been classified as a 2, chair fast. We're not sure of this particular situation. However, from what we can understand here, the patient spends most of his day in a chair. Mobility, ability to change and control body position. This is particularly important for reducing the risk of pressure injuries. So a normal, healthy person has no limitations. They can make major and frequent changes in position without assistance. Naturally, people move about in their sleep. On average, at least every 2 hours, we will roll around in bed just to reduce our risk of pressure injury without even being aware of it. However, some people, you'll notice that they have slightly limited mobility issues where they can struggle to make extreme position changes independently. They might be able to move themselves a little bit on the bed, but not fully roll over or switch from side to side. Very limited is where they can only make occasional slight changes in the body or extremities, but they cannot make significant changes independently. And completely immobile, they do not make even the slightest changes in body or extremity position without assistance. These are the ones that need to be regularly turned. So in this case, the patient is a 2, where their ability to move is very limited. Nutrition. This is determining their food intake because we know that it's a very important for skin integrity as well as healing if a pressure sore begins to develop. Nutrition is important. In this case, the patient has been classified as a 2, so probably inadequate. Rarely eats a complete meal and generally eats only about half of any food offered. Occasionally will take a dietary supplement. Alternatively, if they have tube feedings, receives less than optimum amount of liquid diet or tube feeding, and that could be due to a variety of issues, such as the patient's just not tolerating the amount of food that's been, or tube feeding that's been recommended by the dietitian. And the final section is friction and shear. This occurs when caregivers or patients try to move themselves up in bed and they drag body parts on the sheets. So for example, no apparent problem, the patient is able to move in bed and in the chair independently and has sufficient muscle strength to lift up completely during the movement. They're also able to maintain good position in the bed or chair at all times, meaning they're not sliding down because that can cause shear as well. In this case, the patient's been classified as a 2. There's a potential problem. They can move freely or require minimum assistance, but during a move, skin probably slides to some extent against sheets, chairs, restraints, or other devices. They can maintain relatively good position in chair or bed most of the time, but they occasionally slide down, which puts them at risk for shearing. So once we've added up the score here, the patient's been assigned a 16, which means puts them at mild risk. Okay. So here it's asking for risk to list any other possible risk factors. So in this case, the patient has a history of a CVA, which is another term for stroke, and they have a history of previous pressure injuries. We've written down the dates that these occurred, and we've written down that the final risk level is mild. And even though it's indicated up here, we write it again down here because nurses are allowed to follow the Braden score, but then adjust the score based on clinical judgment. So although the patient's been deemed a mild risk at 16 based on the score, if I'm looking at the patient and I've been providing care for a significant period of time, and I just know that he's at increased risk and needs more careful attention, I can bump him up from a mild to a moderate if I need to. However, if you do make any changes to the risk level, it's important to document in the progress notes as to why you've made those changes. Here it just says the higher the risk level and the longer that risk level applies, the greater the interventions that will be required. That's pretty common sense that we're going to need to do nursing interventions. So moving on here, this is the next page, we've documented that the risk level is mild, and when that's been documented, it's always important to educate the patient and or caregivers regarding how we're going to try to prevent pressure injuries. And so this section is just the nurse and the carer, the wife, both signing that education has been provided and both understand the steps that must be taken to reduce the risk of pressure injuries. The reason that this section needs to be signed is because a lot of pressure injuries can become severely exacerbated and worsen and worse, and patients have been known to die from pressure injuries. So this is the nurse taking responsibility by signing that they have acknowledged the risk, they have educated the family about the risk, and they have informed everybody involved what steps are going to be taken to reduce this risk. Manage nutrition risk. This is just asking that if a referral to a dietitian is required, that the nurse do it. Otherwise, encourage and monitor patient intake of diet and fluids and nutrition support. What the nurse is signing in this case is that she has read this and she is acknowledging that she will do this. She will monitor the patient's diet and fluids and provide assistance where required. It's important to document this every day in the progress notes. In this case, manage moisture risks. All patients need to keep their skin clean and dry. That's pretty straightforward. Avoid rubbing patients dry, just pat them. And for high or very high risk patients, moisturize twice daily. And that's deemed not applicable in this situation as the patient is not considered a high or very high risk. The nurse has documented the type of continence products used and when they were initiated. And then there's just some more information in terms of how frequently the patients should be repositioned and if that needs to be changed if the patient's condition deteriorates. And that is it for these 2 pages regarding the Braden risk assessment.